Thomassen, Dr. Michael Thomassen from Nebraska Equine in Omaha, and I was just going to talk about treating an eye. So eye injuries are really common in horses, and so treating them is something that we're dealt very often. And so some horses are very easy to treat, and some horses don't like their face being messed with at all. But what works well for me is to have a pretty snug fitting halter, and I kind of use that to just give me a little place of leverage for treating it. So the most common way that I treat it is I open their eye and I roll down their lower eyelid so that the pink part of the underside of the lower lid is exposed. And then I put the ointment right on the lower eyelid itself. And then as you let the eyelid go back closed and he blinks, he's going to spread that across his eye. So that way you don't have to worry about scratching the cornea with the tube of ointment itself. And they seem to tolerate it a lot better being having the ointment put on the eyelid versus the eye itself, the cornea. The other thing that you can do is you can, in horses that you really are having trouble getting the eyelids open, you can put just a little bit on a freshly washed index finger, and then sometimes you can't really open their eye too much, and so you can just kind of put it in the corner of their eye and wipe it right on the inside of the lower lid, and then the same thing happens. They blink it across, and then they pretty much treat the eye themselves. So when we're faced with treating eye injuries, that's probably the easiest and most common way to treat them. The other thing to just remember from a safety standpoint, especially in horses that don't like the face messed with, is that they can throw their head and really hit you in the face really hard. So again, having a hand or arm on them gives you a little bit of pushback. So when they come towards you, they'll push your arm back into you first instead of having your face right by their face. So again, safety first when treating an eye.